welcome everyone. It's a pleasure for me to introduce Dr. David Langer, Chairman of the Department of Neurosurgery at Lenox Hill Hospital in New York City. He's part of the Medical Advisory Board of the Brain Aneurysm Foundation, and he's a great physician who cares for his patients. So I'm really excited to have this opportunity to share an experience of his with all of you. So Dr. Langer, how many years have you been in neurosurgery and treating brain aneurysm patients?
Not long enough. So I finished my residency in 1998, so it's been 24 years since my residency. But I also did a fellowship after my residency in open vascular neurosurgery, and then did an endovascular fellowship from 29 to 2010, about 9 years or so after I finished my training. So I've had additional years of training mixed in there as well.
That's pretty incredible. And we're lucky that you chose this path, that's for sure. So let me ask you, what do you find unique and challenging about treating brain aneurysms?
I think you can break it up into two separate groups, people that have ruptured and people who have unruptured aneurysms. I think the ruptured aneurysms are more straightforward. You know, you can't not treat them as long as they're treatable. And in general, the decision-making is more not whether to treat or not. It should be coil or clip or bypass or whatever. So, or stent or pipeline for that matter. I mean, obviously those modalities are often not used for ruptured aneurysms, but in general, the decision is more straightforward. People are sick, they know they bled, or the families know they bled. You're saving someone's life. It's usually more emergent. There are other issues, ICU issues that complicate the treatment, ventriculostomies, catheters at draining CSF. And these are some of the sickest patients on our service. So the intensity of care isn't just me. More often than not, it's our ICU team. I'm very dependent on the group of people around me, even more important than ever when it comes to the ruptured cases. And I think that the uniqueness of them is that they're life-saving. They're often, you haven't met the patient before you operate on them. There's no discussion about the risks and benefits. The families are usually quite, anxious, and there are life and death issues at stake. And so, and quality of life issues at stake. So, and then the surgery or the treatment's really just the beginning, because you have all the intensive care afterwards. So I think that in general, that's much more complicated than the unruptured aneurysm, which I think are the types of people that often are looking at these sites, that are more involved with the brain aneurysm awareness, because once you've ruptured, many people just want to put it behind them. They know they don't have one anymore, and they may reach out for moral support or for, especially when they've had such a traumatic experience, looking for, discussion groups, things like that. But more often than not, it's the unruptured aneurysm patient that comes to the BAF for help. And that just says it all, that, people who have unruptured aneurysms are living their lives, going about their days, and suddenly get something found out that they were living with the minute before, and their life changes on a dime because they've got to deal with kind of this complex decision-making. I would say most unruptured aneurysms that we see don't need treatment at all, that they're often small or in locations that, don't even bleed or have a low risk of bleeding. And so we follow them. And so they're a different category entirely. The number of patients, then you have the unruptured aneurysm patient that has an aneurysm that should be treated. And again, that's based on age, it's based on medical health, it's based on so many different factors of whether to treat an aneurysm or not. But the reason that makes the unruptured aneurysm so special is this whole kind of ethical, moral, metaphysical quality of life concept, and that the vast majority of unruptured aneurysms are never going to bleed. And so we're undoubtedly treating many aneurysms that are unruptured that never will need treatment, but in order to prevent the ones from rupturing being treated, we can't sort of figure that out so easily. Unfortunately, we don't have that technology yet. And so just like much of what we do in neurosurgery, you're basically preventing a problem. You're not reversing anything. And so I think that that's what makes a prophylactic care for such a high risk thing. It's a real responsibility of ours to make these decisions. And unfortunately, I think that because of the nature of interventional right now, there are just so many more people with catheters than there used to be. The number of cases being, there are fewer cases for each individual doctor. And very often I think that the decisions whether to treat are sometimes it's a murky business. And so I think that's why it's even more important as an unruptured aneurysm patient that you find a reputable, not only person, but place and team, because that's really the key. And that's why treating unruptured aneurysms, I think, is so unique. And so I really enjoy that aspect of it and would like to continue doing that for a long time to come.
Yeah, I mean, it is so challenging, again, talking to the people we speak with, and, you tell them, this, you probably won't rupture or whatever, but then they have to live with that. And I know that patients struggle with that. And I know someone from the past who was on our board, hadn't obviously unruptured, and he was about to get married. And he's like, I can't live like this, and had to treat it. So it is a tough call. And I feel the data is just certainly difficult. And 100% telling somebody with a smaller aneurysm that it isn't going to rupture and you can live with it. So it is definitely a challenge, I think, for both the physicians and the patients and their families when it comes to that. And just on that topic a little bit, do you see AI aiding in this at all in terms of following these unruptureds or making it easier or better to educate a patient on why it's okay not to treat it?
Yeah, I mean, I think there are lots of things I'm starting to see now from different centers where they're essentially looking back at all ruptured aneurysms, their characteristics and their size, shape, configuration, location, along with the patient factors. And we know that smoking is a bad thing and hypertension seems to be a bad thing. But still those cause incremental increases in rupture rates. It's not like going from 1% to 50%.
Right.
So they become sort of useless. And because ultimately we're putting everybody into one package, we're saying your rupture rate is 1% per year, which is this threshold that we've sort of arrived at after all this time. But I think that the answer is probably, I think we're going to start looking at MRI characteristics, wall stress, and we'll have more sophisticated imaging techniques that look at the inflammation in the aneurysm wall, things like that. And I think undoubtedly it'll likely be a combination of AI, which means data from all the stuff put into a computer and then spit out like what your risk is. And probably better treatment modalities too. I mean, as the risk of treatment goes down, the indications go up, because if the safer and safer we can deliver, if there's no risk, we treat everyone. So the curves are going in those directions, meaning that the risks of treatment theoretically should be dropping, and the identification of the patients that needed are becoming more sophisticated. So the answer is, I think, is yes.
Okay. All right. Thank you for that. So now a little twist and turn here. If you wouldn't mind sharing with us a not so distant incident that you had that made you become a patient.
Well, I probably should speak to Spine Awareness Foundation.
No, but still you became a patient, which
I
think
it was a profound experience.
It
was a profound experience. I'm still, I wouldn't say grappling with the after effects, but it's had a profound impact on my life. And luckily I'm, physically 100%. But when you break your neck, and I broke my neck skiing, I was skiing with one of my closest friends and was on to his left, and he took a little bit of a harder run. At the top of the run, I wasn't tired, but I had flown in the night before. We had late dinner, got up early to ski, and I work pretty hard, and I'm getting a little older, so you can't just fly across the country, have a couple of martinis, get up at 7 a.m. and feel like $1 million anymore. But I wasn't really fatigued, but it was like 1 PM, and I just remember saying, I'm just going to take it a little more easy on this run. And before lunch, I was on my way to meet my wife, and got to the bottom of the run. Actually, was finished, and it's just basically a berm, like a wall of snow in a narrow path that sort of drops down onto a cat track. So you sort of run along that, ski across the top, and then it's about a 6-foot drop. You just take the momentum and then get back to the lift. And I just remember turning to see another of my buddy's friends who I was skiing with, and that's the last thing I remember. I think I just dropped into a hole in this berm thing, and I just went straight down. I ended up, face down, my arms behind me, sort of like in a squirrel suit.
Uh,
So obviously I had no time to react. It must have happened so quickly. I lost consciousness, I think, for a few minutes. We don't really, probably 3 to 5 minutes. I don't really know. The guy who found me was in our group, but I just met him the night before. We were skiing with my buddies from high school. And I just remember waking up and my head was turned, and I had this terrible pain. And I'm a neurosurgeon. I can, diagnose a neurological problem. And my nose is bleeding, and I went to reach for my nose in my left hand, and I couldn't move my left arm, and then I couldn't move my right arm. And then I realized I couldn't feel anything. And so it was quite something for, I'm on the face down in the snow, and I couldn't move any or feel anything below my neck. And I knew I could breathe.
Yeah.
Which I knew I had a spinal cord injury, a pretty high injury. If you can't move your arms, you're at least a C6, C5. And so the fact that I could breathe means I wasn't like C4 or C3. And I kind of knew I was in trouble, and cycled through a bunch of thoughts that I was just so confused and didn't realize how I did it, and was kind of moaning sort of to myself, like, I can't believe I screwed my life up like this. I really, it was like sort of like a near-death experience in a way. And the guy who found me said, "Are you okay?" Normally, of course I'm okay. Everybody falls.
Right.
Not the first time I've fallen skiing, and I said, "No, I'm an effing quadriplegic." I was super upset.
I can imagine.
But I kind of calmed down, and I read a lot of Stoic philosophy, and I think that really helped me. I began to just calm down, breathe a little bit, and just realize you can only do what you can do. You can only control what you control. The only thing I control is myself, my attitude. And I got through I really cycled through all the aspects of my life that I was going to have to change. I knew exactly what this looks like. In the hospital with, probably a halo, whatever the heck I'd have to go in, and wheelchairs and all sorts of stuff, and learning how to use a mouthpiece or something to talk, to move a wheelchair. I had the whole thing. And then I kind of was like, cool. I was like, look, I'll move we have a beach house. I'll move out of a city. I'll stop, I've had a great life and a great career, and I love my kids. I'll be able to read and eat and not worry about it anymore, and it'll be fine. Like, I was kind of like, it'll be fine. I'll just live at the beach and just chill, what the heck, won't be, I really thought it's not gonna be something. I realized I have to go down the aisle at my daughter's wedding in a wheelchair, and that kind of bummed me out when I was thinking about that. So that kind of has how far I went with this. It was pretty granular. And then the ski patrol showed up, and I said, look, I'm pretty calm at that point. I'm like, look, I'm a neurosurgeon. I have a high cervical spinal cord injury, and you got to fly me off the mountain. I really do not want to go down in a sled.
Yeah.
I just thought, I was at the way back bowls at Vail. It would have been at least 3 lifts and I think 2 or 3 lifts and 3 runs. And, if I don't know what kind of fracture I have, I knew I had something bad, don't take me down a sled. And they flew me off the mountain to Denver. And then my health system flew me home a few days later, and I had the surgery back here with the Lenox Hill guys, Dan Schuba and Mitch Levine. So, and things worked out.
Well, I mean, it is amazing. And I can't even imagine. And that's where, when you know too much, right? When you're in that situation, it's just crazy. So I'm going to ask a question, even though I kind of almost don't want it.
You can ask me anything.
Only because I knew you pre-accident, post-accident, and you are just one of the nicest, most genuine people, so caring. And I've always known that anyone that had used their physician, was super lucky. But after being a patient, do you think that changed your approach in dealing with patients that you treat going forward? Like I said, I know the type of person that you are, but I think this sort of experience probably has to change you a little bit in your approach to when you see somebody who's also just so sick and scared and, in need of medical attention.
Yeah, look, I think there's a lot to be learned from this, that's far beyond suddenly realizing what it's like to be a patient. I think that's a very hackneyed, almost like the typical all-American, the doctor suddenly realizes that he's supposed to be a nice person. Like this Bill Hurt thing with the doctor, this asshole surgeon, motorcycle riding, ego guy that suddenly gets cancer. I mean, I personally think that's just kind of, if it takes that to get you to be sympathetic to patients, I think then you're in the wrong business, especially
Yeah.
as a neurosurgeon. Unfortunately, I can't say that for all of my colleagues, but I can say that for myself. I mean, I built a company that's based on delivering an app to record your office conversations, to have movies of your films. I give people pictures of their aneurysms and their actual angiograms and deliver to a mobile app. I spent the last 15 years because I think people leave the office and forget what you told them. So I've never really had a lack of empathy.
Right.
I'm sort of built that way. But what I did was very, not enough people told me not to come to my own hospital, that there was a element of, you give up your privacy, especially as a physician. If I was injured, we as surgeons associate our physicalness with our sense of self, and patients choose unfortunately, patients, while they probably don't admit it, if your surgeon has a physical ailment, you're less likely to go to them. People are uncomfortable with physical compromise or mental compromise, certainly. And I think that there was concern amongst one of my friends and colleagues that having the surgery back at Lenox, assuming I was going to be compromised. I had a central cord injury, got a lot better quickly, but no one would have conceived that I would have gotten all of my function back as like I did. I'm doing everything, if not more, at least bypass and everything that I did before the accident. And so remember, we didn't know then, what do we know now? And so I think that I felt very strongly of going back to my home and to let my partners take care of me.
Yeah.
I mean, how can you build a department and commit your life and efforts, your career to developing a team and then turn away from them and go somewhere else? It did
Right.
make no sense to me. And wasn't that I was worried about them. Could not be happier. But I think the thing I came away with the most was the nursing. That
Tough. Take your time.
no, I mean, being here with our nurses was, I think that doctors just, I realized that we really trained in separate silos from the very beginning. I don't think I knew a nurse in nursing school that had any kind of relationship with during my training in medical school. I think there's a profound disconnection between a nursing training and physician training for many reasons. Many having to do with the cultural differences. I think the research and efforts that doctors make isn't matched very often, especially early on in nursing. And there's a bit of an intellectual bias that the doctors have towards themselves.
Right.
And I think that this lack of connectivity early on, it really does develop into a lack of not only cultural overlap, but respect. And I think this continues through residency. We're trained, we round separately very often. Even if we round in teams, it's often, more difficult. The nurses sign out very often at the same time we do. There tend to be shift workers very early on. We weren't, as residents, we weren't really shift workers yet. We didn't have the hour rules yet. So
Right.
we were all there all the time. They weren't. And doesn't mean that we haven't had, but there are many doctors that marry nurses. We get to know them pretty well during our training or afterwards, but we see them as, maybe love interests or significant others rather than partners. And
Right.
The kind of realization I had was just what they do. I had no idea. I really didn't, despite all this, the time spent up there. We go up there, we wave at our patients like we're like the royal family. We come through there, everybody showers us with gifts afterwards, and we think, our what doesn't stink. And we go up to the unit and, we're there maybe for a few minutes of the patient, and then we leave. And I do think that the doctors don't matter. The intensive care doctor does, but I think that the nursing competence and what they do and their what they spend their time doing and how important they are to the good outcome of the patients is just so unique, and something I wasn't that I wasn't aware of it. I was had a blind spot, and it definitely impacted my career in a negative way, not knowing that, I think, or not realizing. I think that I probably projected that, admittedly. And this happened with the rehab doctor also. Like,
Yeah.
I remember having a certain kind of not a bias, but like the doctor who runs the rehab, I'd known for years, but I didn't respect him. Was just like, he was, not as ambitious as I was, and probably was a little less outgoing, and he was a rehab doctor. And
Right.
so I would just had a certain, attitude about that. And I probably projected that as well. And when he came in and talked to me, I just I
Yeah.
kind of realized that. And so those are the experiences. I had a lot of self-reflection,
Yeah.
and really time to I think repair some of the I would call them, not wounds, but scrapes that I wouldn't call them wounds. They weren't that deep, but they were, like I'd failed to develop the right attitude and the right awareness of these things as a physician and as a neurosurgeon. And I developed a real respect for the rehab team, the physical therapists, the occupational therapist, speech, cognitive therapy, all these things, and the nursing. And it's good now that I have it. It's not going to go away.
Yeah, well, I think it's amazing for you to vocalize that and to share it with others. And again, knowing the type of person that you are, it's just, I think the way that the training is, the way the systems are set up, that you don't even have the time to stop and really think and value these people to the level that maybe, your partner should, until you're in that position. But so it's good that you see that now, and I'm sure they appreciate it. But again, that's the path that they're on, and I don't think they're really looking, for these accolades along the way. But for sure, like you said, for treatment of an aneurysm, it is critical to go to major centers where there is a good team and, people giving that care in all aspects. So that's really nice to hear you say that.
Yeah, I mean, I think that, I spent, you can come in, she can come in. I think that I don't think it's purposeful. I don't think doctors purposely want to not respect nursing. In fact, I think
No.
and I think what happens is we're just on these parallel pathways for so long,
Right.
with there's no leadership. There's nobody saying, and frankly, it's not a surprise. And the benefit of this for me was that I not only had the experience to where I was able to recognize it out by myself, I still have time to repair that.
Right.
And actually what I did is I came back after, if I was a patient, I spent 2 days as a nurse in our ICU. All my partners are like, you got to be crazy. I put on a white, I had all this, I spent 2 days up there, and, it was great. I really saw where they sign out, their technology problems, and it was just great,
Yeah.
and I think that those are the kinds of things we should all do, and never diminish this is a team sport. And I think that that's why, as an aneurysm patient, that's why you have to choose a place that has a great team, not just an individual, which unfortunately we tend to promote ourselves really, really well.
Yeah, no, it's the doctor is important too, that's for sure. But yeah, the team, when there is a nice team, it does make a world of difference for the patient and their caregivers.
Yeah.
But thanks for talking about that. So recovery from many diseases and injuries is a long mental and physical journey. So tell us how meditation played a role in your recovery, because I see it coming up a lot more with different people and interests from patients in meditation. And I haven't done it. I know we talked about it before. I have yet to make that leap, but I just would like to hear how that helped you in your recovery.
Yeah, I mean, no, people, it's one of these things people don't talk about. It's kind of like people don't talk about therapy. They don't talk about their kids or their marriage problems. They certainly don't talk about meditation. I don't know. It's cultural, and it's kind of like it's a little bit showing vulnerability, like admitting that you might not be perfect and that you need something. Yeah. I think that's where it probably comes from. Everyone wants to show strength rather than weakness, and I get that. Showing vulnerability, I think, is not easy, and it requires a fair amount of self-confidence. When I woke after I got to rehab, I realized I literally all my anxiety went away, probably just from what I'd been through. I really don't carry anxiety with me anymore, which is really odd. I feel sadness and I feel stress, but like I don't wake up with, I don't have anxiety like I used to. And during rehab also, I just started using the Calm app. It was probably a few months afterwards. I thought it would be a good time to try. And one of my colleagues suggested I try meditating, and he actually took me through. He's actually like a meditation like guru. And
Okay.
he actually took me through my first meditation on Teams, on
Okay.
like through a Zoom call,
Yeah.
which was great. It was like a guided meditation, and to be honest with you, it was harder at the beginning than it is now. I think it takes effort. It's like to build up your body, you physically exercise, and I think to build up your mind, you need to meditate. And I rarely miss a day. I get up earlier in the morning because you got to find time to do it. I usually get up pretty early and meditate in the morning, probably about 20 minutes. I do a specific guided meditation on the Calm app, and it's great. Like I think I feel different. Like 3 months, 4 months later, I'm a different person. I'm the same here, but I think that my countenance and the way I deal with things has changed for the better. And I feel very lucky to have gone through what I went through. It really opened my eyes to, all these different things that, again, I have a bunch of years left and I can live this way. And that's, I'm excited about it and really glad this happened in this
Yeah.
odd way. It's been
Yeah.
the best that ever happened to me.
Yeah, that's amazing to hear. Some people may be questioning that, but yeah,
A
I
lot of people do.
understand it. It gives you that new perspective. So, and on the topic of meditation, would you recommend that? I mean, specifically for someone recovering from brain aneurysms, because they struggle with not being the person they were before, and they're trying to find their new normal. So it just seems like this could be a track that people really should take that leap, that step.
Look, I think it's good for anybody.
Yeah.
And I think that it goes without saying that if you have these major disruptions in your life, that's the right time to do it. And I think that if you do it before you find out you have an aneurysm, you're probably better off when you find out when you have one.
Right.
I think that the families as well. These are things we can't control. You have to realize that when you have something you can't control, then the only thing you can control is your reaction to it, and to your will has to be right, do the right thing, and it's all you can control. We can't control our emotions, are reactions to our perception, and meditation helps modulating that. It allows us to step back from our anger. It allows us to step back, take your time and listen to and ask yourself, the person that's connecting that emotion to a perception, you can step back and separate the two. Right. Because there's that side of you that just, oh, I'm angry and I'm gonna jazz this up. So the answer is absolutely. And it's hard at the beginning. It requires a real effort. It requires motivation and persistence, because it's not easy. Somebody the first few times, like, what am I doing? You're sort of rolling your eyes. But
Imagine.
I think it's something it's served me very well. And I think the people who are consistently doing that, I think they would all agree that it's probably one of the more beneficial things they've done.
Okay, that's great. Well, again, Dr. Lang, I want to thank you so much. With September being Brain Aneurysm Awareness Month and our Day of Engagement is September 15th, we just want to, share more with the people that follow us, just educate them, raise awareness, and give them something new to think about. So I figured I know, great presenter, and your story's amazing, and meditation's been a hot topic. So happy to bring it all together. And I just want to say thank you for being, the person you are, the doctor that you are, and for caring as much as you do. It means a lot, and you certainly touch a lot of people's lives. So I'm happy I've met you and our paths have crossed. So thank you very much.
No, I appreciate that. I mean, I've known you for a long time, before even when I was probably a resident, I think, and early attending, I think, having these people that follow along their path, it's always, I'm sure it's really interesting to see how people move up the food chain, and you're like, wow, I remember that guy when he was, but the truth is I'm the same person. I have learned a lot along the way. And I think it's my time in my last trimester to give some back. I appreciate how hard you've worked at this foundation. I know that this is near and dear to your heart, and has always been I look forward to seeing all the meetings and stopping by the booth. And I think you're doing a great service for people, and I'll do anything I can to help, whether it's in the hospital or outside the hospital. And I appreciate you giving me the opportunity to share that with you, with your group. So thank you for doing that as well.
All righty, awesome. Thank you so much. Have a good one.
Right.